The purpose for this gathering is to draw attention to the President's 2-year comprehensive response plan through the National Agency for Control of AIDS. Stakeholders and other partners are here to discuss the need to develop a robust plan that would help bridge and improve HIV/AIDS services in the country. Before now, the position of the service delivery in HIV/AIDS was donor-dependent through the United States President's Emergency Plan for AIDS Relief, PERFA. In the light of the partnership agreement signed in 2010, that by 2015, Nigeria should be able to provide over 50% of HIV/AIDS domestic funding.
The President's Comprehensive Response Plan was not just for the federal government. The states were supposed to key in and bring counterpart funding. We've not gotten much counterpart funding from the states, but we know that as we go around, we're hoping we can get much more funds from them. But for now, we think it's one of the biggest strides we've achieved in this progress. And so we felt with the funds we have, let's take over Abia and Taraba state sites so that the government of Nigeria can take ownership. And then subsequently, as more funds come, we go to other states. So that's why we're actually here today.
Abia is one of the pilot states to benefit from this project. But how prepared are they to take up the responsibility and reduce HIV/AIDS in the state? The responsibility of providing care and improving service delivery in the fight against HIV/AIDS may not just be that of the National Agency for Control of AIDS.
I have no doubt that if government decides to do it as they have decided, they should be able to do it. You know, if you look back during the past few years, most of the funding for HIV has been coming from foreign donors. And then we can now see some form of donor fatigue. So we see a lot of donors talking about ownership, government ownership. We cannot keep waiting, so it has to happen.
Individuals and other private organizations are also said to have a role to play.